Let's now discuss pericardium 6, or the inner gate point, a Luo-Connecting point. Pericardium 6 is located 2 chun proximal to the anterior wrist joint space, which is the most distal wrist crease, between the tendon of the palmaris longus and the flexor carpi radialis muscles. How to find pericardium 6? As the location of the wrist crease varies, the wrist joint space is a more reliable reference point. It can easily be palpated by moving the patient's hand in a relaxed way. From the center of the wrist joint space where pericardium 7 is located, measure 2 chun in a proximal direction and locate pericardium 6 between the 2 tendons, which become more pronounced when the fingertips are pressed together. If only one tendon is visible, this will be the tendon of the flexor carpi radialis muscle. Pericardium 6 is located on its ulnar aspect. Or we could also use the quick method. So how to do this? From the center of the wrist joint space, glide in a proximal direction between the 2 tendons. The skin will begin to form a bulge in front of the sliding finger, which will come to a halt at pericardium 6. Triple burner 5, which is 2 chun proximal to the dorsal wrist joint space, is located opposite pericardium 6. Pericardium 6 is needled 0.5 to 1 chun vertically or obliquely in a proximal or lateral direction. Caution should be exercised in needling this point as the median nerve is located directly below this point. For its actions and indications, pericardium 6 calms the Shen, unbinds the chest, harmonizes the stomach, and opens the channel. For special features, PC6 is the Luo-Connecting point of the pericardium meridian. It's the opening or the master point of the Yin Wei, the Gao-Wu command point of the thorax. It is also the main point for nausea and vomiting and a very important point. Pericardium 6 is one of the most important points of acupuncture with a great number of different functions. It has a specific action on the chest and can therefore be used for any chest problems. More specifically, it moves qi and blood in the chest and is the point choice for discomfort or pain in the chest due to stagnation of qi or blood. It has a powerful calming action on the mind and can be used in anxiety caused by any heart pattern. It also calms the mind by its indirect action on the liver, to which the pericardium is related within the terminal yin. It can therefore be used for irritability due to stagnation of liver qi, particularly if combined with anxiety from a heart pattern. It is particularly effective in women and is most useful to calm the mind in women suffering from premenstrual depression and irritability. It also promotes sleep. In addition to its action on the heart and liver, it is a major point to affect the stomach, particularly the upper and middle part of the stomach. It subdues rebellious stomach qi and the point of choice to treat nausea and vomiting. It can also be used in most excess stomach patterns characterized by epigastric pain, acid regurgitation, hiccup, and belching. As it is the connecting point of the pericardium channel, it connects with the triple burner channel, and it is effective in treating neck ache on the occiput, especially in women. Women often suffer from neck ache after a hysterectomy, and this point is very effective in treating it. Indeed, the explanation of the acupuncture point says, when the pericardium is empty, there is stiffness of the head. Finally, owing to its relationship within the liver and its action of invigorating blood, This point indirectly connects with the blood of the uterus and can be used to regulate irregular or painful periods. The pericardium influences the uterus due to the connection between the heart and the uterus through the uterus vessel or the palmar. Here is a diagram showing the relationship between the pericardium, the heart, and the liver, where the pericardium directly connects with the liver because both are with the terminal yin. The liver directly stores blood, which supplies to the uterus. Pericardium connects to the uterus through the heart, which is directly connected with the uterus through the palmar or the uterus vessel. So to summarize its functions, pericardium 6 opens the chest and moves qi and blood, which is good for chest pain, palpitations, feeling of tightness of the chest. It calms the mind, so it's effective for insomnia, manic behavior, poor memory, anxiety, fright, sadness, and depression. It moves liver qi, so it's good for hypochondrial distension and pain. It harmonizes the stomach, so it's effective for treating nausea, vomiting, hiccup, belching, epigastric distension, and pain. And finally, it invigorates blood and regulates menstruation. So it's very effective in treating irregular periods and painful periods.